experimental treatments. Okay. Now, what's interesting here, these studies began at Yale University, and what they did, they used animal studies, and they subjected animals to levels of trauma that are enormous. And what they found is the animals that were really tortured and traumatized horribly ultimately showed signs of brain damage. And this is one consequence of prolonged exposure to extraordinarily severe stress, is high levels of cortisol causing damage to the brain. But what they found was if you give these animals who are being traumatized Clonidine, then not only do they show less behavioral manifestations of anxiety, they're more steady and they're less distressed, they didn't show any signs of brain damage. Now, what this has led to then, there are a couple of human studies that suggest the same thing, and that is that with extremely severe stress, especially if it's prolonged, you can cause damage to the nervous system because of high levels of cortisol. But if you go in quickly, and quickly may mean within a few hours or maybe the first couple of days, and treat with Clonidine, in addition to rapidly reducing anxiety, it may be neuroprotective. It may, in the long run, protect these downstream changes in cortisol levels and keep the brain from being damaged. And you know what? You got these two pathways with PTSD. A lot of people eventually overcome this, with or without therapy. Okay, they resolve it. But the people that go down the pathway of chronicity, it tends to get very entrenched, very, very hard to treat. The group of patients where it's probably the worst are people that have either been in concentration camps or something similar to that. So some refugees that have been tortured and that sort of thing, and combat-related PTSD. And it's suggested that part of the reason it's so treatment resistant is because it has damaged the brain in some ways. So using Clonidine very quickly after a traumatic event, in fact, may be one of the few actual medication preventive approaches in psychiatry, not only to reduce anxiety so that people don't feel as overwhelmed, but also to protect the nervous system from getting slammed by high levels of cortisol. Okay, is that making sense? All right. What's the downside of this? If you use it for a really long time, some people get depressed. The other downside is it causes a drop of blood pressure, so you got to be careful and stand up too quickly. But other than that, it's fairly well tolerated. This is very interesting. This is D-cycloserine. You know what? Every drug in psychiatry was discovered by accident, or at least the initial drugs were discovered by accident. And that's true with this. This is an antibiotic that was used many years ago to treat tuberculosis, and it has not been used very much because there are other drugs that are better. But one thing that's been found is there's something about administering this drug that helps people benefit from exposure therapy faster. Okay, the process of extinction, if you have a fear, an acquired fear, like you're in a bad traffic accident now, I'm afraid to drive, okay, you can get therapy for that, or you can just force yourself to get back out and drive, and the amount of time it takes to repeatedly get exposed and have the fear diminish is what I'm talking about. Now, here, and this is absolutely experimental, okay, what they did is they used 50 milligrams of this drug 1 hour prior to being treated. And they had, this was used in a study where they were looking at treating public speaking anxiety. And they had a double-blind placebo control, and it was exposure-based therapy where they get people to stand up and repeatedly do things in front of an audience. And what they did actually in front of the audience was not give a speech, but they had people stand up in front of a large group of people, and they would throw at them math questions, and they had to figure it out in their head. Considered to be quite stressful, okay? But look at this, 50 milligrams 1 hour prior, after 5 sessions, significant decrease in anxiety over 5 sessions of exposure therapy. Now, what's going on here? Well, obviously, it didn't have anything to do with the effects on bacteria. You know, it's an antibiotic, but a lot of drugs have multiple effects, and this appears to have some kind of impact on the neurotransmitter glutamate. So this is you know, there, again, like with all experimental studies, it needs to be replicated. We need to see if this is going to work with other kinds of disorders. public speaking anxiety is not exactly, a horrible epidemic that we need to deal with, but there's promise here that it may actually speed up the processes of deconditioning or extinction. Okay? This is very interesting, and it's still considered experimental, but it's been picked up and it's being widely used by the military and also the Veterans Administration in dealing with people that have PTSD to treat nightmares. This is one of the early high blood pressure medications, okay? And the brand name is Minipress, and what was found is in treating some of these veterans who had high blood pressure, and high blood pressure is really common, they just found by happen chance that once they started taking this medicine for their hypertension, these people had chronic PTSD and chronic severe nightmares, said, I'm not having nightmares anymore. It's like, oh, really? Okay. So this was the first study, and this has now been replicated. Here, it was just 8 weeks, 40 veterans, and again, combat-related PTSD tends to oftentimes be very hard to treat and very severe. And I will tell you, when you have ongoing nightmares, it is bad news for lots of reasons. One reason is that if people have recurrent nightmares about the trauma, then at some point they get afraid to go to sleep. And when you get afraid to go to sleep, now you've got what? Sleep deprivation, and that just throws gasoline on the fire. I had this one patient who told me, I can't even remember how long ago this was, she said, she got raped. She was a UC Davis student, she got raped, and she said, some of my friends tell me, for God's sakes, I know it was really bad, but it only happened once. It's probably never going to happen again. Just deal with it. And she said to me, she said, hey, guess what? It didn't happen just once. It happens every night. And that was really eye-opening for me because she had these recurrent nightmares. So targeting nightmares in itself just brings relief, but it might also give the opportunity for people to have better quality sleep and then function better. So this is a drug for high blood pressure, so you always have to start small doses because if you go too fast, people get low blood pressure and pass out. You can see here what the average dose was, but if you take a look at the effect sizes, it's extremely rare to find effect sizes that are this high in psychiatry. I mean, this is very, very robust, okay, and what a godsend. And who would have known? And the mechanism of action, how it's doing this is not understood.